we call high risk that meets that threshold for ordering a breast MRI? Well, the American Cancer Society did come out with some guidelines, and they recommended screening MRI for women who have a 20 to 25% lifetime risk. Okay, so that's the lower limit, and I just wanted to emphasize this is a lower limit. This isn't just a general limit. So you don't want to send everybody for breast MRI. You want to make sure that they truly meet the high risk bar. What does this mean practically? Well, there are some indicators of high risk that you can just figure out historically. For example, if someone has a genetic mutation, if she's a BRCA1 or BRCA2 carrier, I think everyone would agree that's a high-risk patient. If a patient has a first-degree relative that's a mutation carrier, say the patient herself doesn't want to be tested, but you know that her sister is, you count that. Very strong family history. If there's more than one first-degree relative with breast cancer, for example, or say there's premenopausal breast cancer or a male relative, something unusual like that. Previous chest radiation therapy, this is people, young patients who've had Hodgkin's disease in the past, and they had to have mantle radiation. So certainly if they have a mutation, BRCA1, BRCA2 gene mutation, or some other genetic predisposition for breast cancer, they should have breast MR screening, or if they have a first-degree relative with a gene mutation, or very strong family history, so multiple first-degree relatives, all right? Patients with previous chest radiation therapy is kind of a lighter green. It is an accepted indication for breast MR screening, but now with more modern radiation therapy techniques, a lot of times they are sparing a lot more of the breast tissue. So the mantle radiation isn't as toxic, I guess, to the breast tissue as it used to be. So, so for now, if they've had radiation therapy for Hodgkin's disease, we'll accept them for breast MR screening. But just know that they may not be as at elevated a risk as we once thought because of improvements in radiation therapy.